On Minnesota and Wisconsin's efforts to slow the spread of the coronavirus. Now, today there's a focus on the future. Even as more infections are being reported today by health officials, Vice President Mike Clinic at this very hour to hear from Governor Tim Walz, Mayo Clinic, and University of Minnesota officials about their efforts to greatly increase COVID-19 testing. Here in the state, testing is one of the goals Governor Walz says is important in order to reopen Minnesota's economy. Meanwhile, in Wisconsin, Governor Tony Evers is reopening 34 state parks and recreation areas this coming Friday. Now, the change comes as temperatures are increasing and more people, of course, are looking for outdoor recreation options as social distancing measures remain in place. We're monitoring all these developments for you this afternoon, but now we head live to Madison, where we are getting an update from the Wisconsin Emergency Operations Center.
Here at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in the order in which they RSVP'd for this event. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. In that role, I command the 10,000 citizen soldiers and airmen of the Wisconsin National Guard, and I'm responsible for overseeing Wisconsin Emergency Management and our State Emergency Operations Center, otherwise known as the SEOC or SEOC. Once again, I'd like to thank you for taking the time to join us this afternoon as we give an update on our efforts in response to COVID-19. The Wisconsin National Guard is busy with more than 1,000 citizen soldiers and airmen serving in direct support of the state's response to the pandemic. Several mission highlights include the mobilization of specimen collection teams in an effort to increase the state's COVID-19 testing capacity. We have established testing at a number of senior living facilities, correctional institutions, and other organizations. We are also conducting call center operations to assist with notifying people of their results. Other ongoing missions include a warehousing mission where soldiers are receiving shipments of personal protective equipment, also known as PPE, repackaging them and distributing them across the state. We are also involved in shipping testing supplies all across Wisconsin. We have additional citizen soldiers serving as temporary nursing assistants, and we are supporting state-run voluntary self-isolation centers in Madison and Milwaukee with medical monitoring and administration. We have another team supporting the Dane County coroner assisting with mortuary affairs operations. We continue to work hand in hand with our partners across the state and at the local level in support of Governor Evers' COVID-19 response. I'm extremely pleased with the soldiers and airmen who have played such a vital role in this response. I am equally proud of our State Emergency Operations Center, where members of Wisconsin Emergency Management are working hard behind the scenes. The work being done out of the SEOC has been critical to ensuring PPE and specimen collection supplies are making it to those working on the front lines of the response to COVID-19. I'm very happy to report that yesterday we welcomed home approximately 150 soldiers returning home from Afghanistan. These men and women are part of the 1st Battalion, 128th Infantry Regiment. I want to stress that the return of these brave soldiers is not COVID related, but part of a planned drawdown in Afghanistan that was announced earlier this year. I look forward to answering your questions, and again, thank you for the opportunity to provide an update on the state's response to the COVID-19 pandemic.
Thank you, General. We will now hear remarks from DHS Deputy Secretary Julie Willems Van Dyke.
Good afternoon. I am very pleased to be with you this afternoon as well, and would like to talk with you about where we stand with testing and tracing. Testing, tracing, and tracking the spread of COVID-19 are key components of our Badger Bounce Back Plan, and none of them can happen without an adequate supply of the PPE that the General was just speaking about, or adequate hospital capacity to both treat COVID-19 positive patients and provide care for all the other conditions that make us sick. Badger Bounce Back is an interconnected plan. No one part of it is enough on its own, and all parts need to happen at once. So, as I mentioned, today I'd like to dig into testing and tracing with you. Testing is integral to Badger Bounce Back. We've all heard this from the national media from the very beginning of this crisis. We need more tests, and they're right. And here's why. Even though we have done an outstanding job of flattening the curve by staying safer at home, we are all still susceptible to COVID-19. So to make it safer to leave our homes, we need to substantially increase testing, so we know who has COVID-19, and we can make sure that ill people and their contacts who may be incubating the disease continue to stay at home until they're through that incubation period. It's about isolating or boxing in the people with the virus rather than isolating and boxing in all of the people. So taking our lab capacity from the ability to perform 0 COVID-19 tests in early March to nearly 11,000 tests per day now is one of our success stories here in Wisconsin. But capacity is not the same thing as utilization, and we have some work to do here. Currently, we are using between 2,000 and 3,000 of those 11,000 tests per day. The most important thing for the residents of Wisconsin to know is that we are increasing to testing, and that anyone with symptoms should contact their healthcare provider and ask to be tested. This is a big change in the guidelines for our healthcare providers when it comes to test access. Only a month ago, we told them that they should only test the most ill people due to the shortage of testing supplies. We've recently updated our guidelines to encourage this widespread testing, and we acknowledge that it's a big shift, which is why we have a team here at the SEOC working with healthcare providers. Clinics that would typically counsel people to take care of symptoms at home so they don't bring infections into the clinic are now being asked to change from an individual health focus to a public health focus, and that means bringing in more people to test. But testing alone is not enough to contain the virus. Another key part of Badger Bounce Back is tracing every one of those positive tests. This means that we contact everyone who has a positive test, and in fact, we are moving to contacting everyone who has a test, even before they know the results, to let them know they must isolate at home until their test results come back, and then if they are positive, they need to stay at home until they are symptom-free for at least 3 days. We also need to identify the person's close contacts who are at greatest risk for developing COVID-19 and spreading it to others, so that we can tell them to quarantine at home for 14 days, that period of time when they may become sick. Contact tracing begins with your local health department, and because of the increasing workload, the State Department of Health Services has also been supporting many local public health departments in this endeavor. To help with their workload, DHS has trained 259 contact tracers from our own department and other state agencies. These contact tracers are currently working in the field, and we are onboarding 78 more, plus an additional 50 who will start training this week. Our goal is to have 1,000 contact tracers between the DHS surge capacity and the capacity of local public health departments. We're also investigating ways that technology can assist us with this very big task. Just think about what we're aiming to do. If we conduct 85,000 tests per week and 10% of them are positive, as we're seeing now, we will need to interview 8,500 people. And if each of them has 5 contacts, that's another 42,500 people to call. We're not there yet, but we're making progress. Just like Badger Bounce Back is an interconnected plan, the SEOC is doing work that is interconnected with the work you are doing by staying safer at home. By limiting trips to only going out for the essentials and physical distancing, you are all working to flatten the curve, just as we are taking actions like expanding testing and contact tracing to make our community safer once we begin to open up more businesses and services. Thank you for your partnership and for all of your hard work, and I too welcome your questions.
At this time, we will open the line to questions from reporters. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we'll be taking one question per outlet.
Well, you were listening to an update from the Wisconsin State Emergency Operations Center. The briefing opened with Major General Paul Knapp, the Wisconsin National Guard Adjutant General, talking about how the Wisconsin National Guard is helping in getting equipment for testing supplied around the state, PPE across the state. Mentioned working with the Dane County coroner, too, for the activities that are taking place over there. Then we heard from the Department of Health Services Deputy Secretary Julie Willems Van Dyke, who clearly has had a shift in focus, talking now about the Badger Bounce Back program, which is all about testing, treating, and tracking. She talked about how they are increasing testing and now, for the first time, truly encouraging widespread testing across the state of Minnesota. We're now waiting for the daily briefing from the Minnesota Department of Health. That is scheduled to happen at 2 o'clock. They are getting ready to address the media. But in the meantime, as we told you earlier, the Vice President Mike Pence is also visiting Minnesota right now, and that's where we're going to go now. He's meeting with Tim Walz, and Mike Pence is touring places talking about testing here in Minnesota. So let's go live now to Vice President Mike Pence's visit here in the state of Minnesota.
Right. They wanted me to pass along to you and Dr. Hahn how much they appreciate the way that you knocked down all those barriers, that you had the fast track authority there for them, and they could make this happen. It was quite a team effort between both your group and, of course, the people here at Mayo. So with that, thank you for being here, sir.
Thanks, Congressman. Good to be with you.
Thank you. Thank you, Dr. Persia. Mr. Vice President, it has been an absolute honor to serve with you in the White House Task Force. Thank you for your leadership. Governor Walz, really congratulations on the job you've done in Minnesota. It's been a terrific partnership with the federal government, but also with the FDA. And Congressman, your leadership and support in Congress has meant the world to us and the federal government and FDA, so thank you very much. I just wanted to start on behalf of the 18,000 scientists, doctors, nurses at the FDA to extend our incredible heartfelt thanks to the frontline healthcare workers here at the Mayo Clinic and around the country. We know that you are the true heroes in this and really very much appreciate everything that you're doing. And our thanks to the Mayo Clinic. It's almost an unprecedented partnership that we have. President Trump has asked the FDA to reduce obstacles and red tape to allow the great American innovators to bring medical products to the American people. And that is illustrated no better than here at the Mayo Clinic. You truly bring science and medicine together, and you are just terrific innovators with the serology testing, with the molecular testing that you brought on so quickly and helped us to scale up around the country. And then with convalescent plasma. And I just want to emphasize what the Vice President has just mentioned about convalescent plasma. Our preliminary data suggests that there might be benefit here. We must wait for the clinical trials to tell us the answer to the question about its benefit. But in the meantime, Americans can give back, as they have done throughout this epidemic, by donating plasma. Just a few facts about that, and the leadership of the Mayo Clinic's been tremendous, and they're the leaders of this expanded access program. Over 2,000 sites have registered. Over 6,000 patients are now registered as part of this protocol. And we heard today that the 3,000th patient is going to be treated with convalescent plasma, potentially life-saving therapy. We're now at 1,000 collections per day. That's terrific news, and we're going to, of course, want to scale that up further. So my many thanks to the Mayo Clinic and Mr. Vice President for your leadership and leadership of the President.
Thanks.
Thank you. And with that, I'll hand it to our Executive Dean for the practice, Dr. Williams.
Thank you, and thank you for giving me this opportunity to just tell you a little bit about the practice. I want to start by the beginning of our journey with robust modeling to determine what we needed to do to quickly, within days, transform our practice to care for COVID-positive patients and a surge that we thought was coming. And then when we realized with our modeling that we were going to be with this virus for quite a while, we had to again transform our practice to create a safe space for both COVID-19 patients and those that don't have COVID-19, because a lot of individuals need their care. And we were able to do that very quickly. In addition to that, we were able to set up wonderful clinical trials, and we have had great success in treating COVID-19 because the majority of patients that come into our hospitals or even don't make it into the hospital but are out in the outpatient setting are enrolled in clinical trials. We have significantly decreased the mortality in our ICUs. Everything that we have learned from expanding our virtual care to reach the patients that can't travel here, to monitor people at home who have COVID-19, to immediately understand early on when they start to have symptoms, to give them earlier treatment. All of that has been very important and will actually help us as we move out of COVID-19 and into a new world where we do things even better than we do now. I want to thank you all for your help in being able to cross state lines with our virtual care. And in fact, we were able to help a hospital in New York doing virtual ICU to cover their ICUs with our experts here. That's what it's all about. We are absolutely here to share all of our knowledge, all of our expertise, all of our learnings from this experience, because together we can all fight this pandemic and the next one will be ready.
That's great. Thank you, Dr. Williams. Great report. This is an extraordinary institution, and the healing beyond coronavirus goes on every day. And
Yes.
the way you've responded here, never missed a beat. And I also want to commend you, Dr. Ferrugia, about we did open up the rules and regulations about practicing across state lines, and Mayo Clinic was part of that surge of medical professionals being able to render assistance in New York through telehealth and in person, and we're grateful for that. We truly are. And I know the people of New York are grateful, so thank you.
You're welcome.
Thank you, Dr. Williams. It's a nice statistic that every day currently we do more telehealth visits than we did all year in 2019. So every day we do more than we did in 2019 because of what's going on.
I expect you think that telehealth has now scaled up in response to the coronavirus, but it will likely continue to be a great benefit to the American people. We're looking right now at how we make permanent some of those changes in telehealth.
We can reach more individuals than we were ever able to reach before. We can keep them safe at home.
Right.
It will also help our efficiency once people do come into our medical centers, because we can do some pre-visit work that we haven't been able to do as robustly in the past. So it is something that we'll take into the future with us for sure.
Yeah, I know that Dr. Hahn and I have talked about it, and the Center for Medicaid and Medicare Services is looking at taking what are waivers that have allowed telehealth and now looking at how we can make that more part of modern American medicine.
Thank you.
In ways that, and with the coronavirus, it allowed people to consult their doctor without coming into an emergency room, without coming into the doctor's office and potentially exposing other Americans or family members. So great innovation.
So
that's a remarkable statistic.
Yeah, it is. Just in the interest of time, I'll move on to Dr. Badley, who's going
Sure.
to talk to us from the Healthcare Task Force.
Well, thank you for the opportunity. So, with our decades-long history of research in every discipline, we feel that Mayo was ideally suited to respond to the COVID outbreak. And when we compare how we are today compared to the onset of HIV, science is at a position now whereby we can move forward and get treatments and understanding so much more quickly, and that's because of your administration and other administrations' ongoing funding of basic science. So thank you for that. 7 weeks ago, Drs. Gores and Ferrugia asked us to establish the COVID-19 Research Task Force, and we did so. And we put together 16 parallel work streams that cover the breadth of research, including biobanking, genomics, immunology, and everything else. Together, we put together with our pharma partners 9 clinical trials on COVID-related therapies. We've activated them in days rather than weeks to months. And these trials cover the spectrum of disease from outpatient through intensive care units. Fortunately, we've not been overwhelmed with the numbers of patients that we've seen in New York City's, and that combination of not being overwhelmed plus our access to trials have resulted in very good outcomes. So within the Rochester system, we've had 500 cases with 5 deaths for a 1% death rate. We've had 60 patients hospitalized with 2 deaths, and 70% of patients in total have been on some kind of experimental therapy, including plasma and others. And as of the past several weeks, we're at 90+% of patients are on a clinical trial. And we believe these are making a difference for all of our patients.
Wow.
So from the research standpoint, we thank you for and request continued funding into the future for discovery science and public health programs, accommodations for those researchers whose programs have been interrupted now, and then we wish to continue to offer Mayo involvement in national treatment guidelines and initiatives as we plan to move forward.
Great.
Thank you.
Thank you, Doctor. That's really remarkable. 90% of your coronavirus cases in Rochester or in Minnesota as a whole?
In Rochester.
In Rochester are
On clinical
receiving
trials.
on some kind of
Yeah.
therapeutic.
Actually, not in Rochester, and in our Mayo system, it's Florida, Arizona, Rochester, especially in Rochester.
Oh, that's remarkable. And I know they don't want me to get ahead of things, but are you encouraged by any of the early results in some of the therapeutics? This is an
I
area,
think
we
there's-
talk a lot about vaccines, but I want to assure people we're just as focused on encouraging the development of therapeutics.
I
which
think
can bring
there are-
relief to people.
I think there are 3 or 4 drugs that we're testing that are showing signals of activity. And as we heard earlier, it's premature to make conclusions until the trials are done. But we believe they're making a difference. Vaccines hopefully will be started within several months. They'll take a year or more to get efficacy activity. But I think there's great cause for optimism. And again, it's because there's been such sustained funding for decades that allow us to understand science. We can, within weeks, understand the virus, the genetics of the virus, the host immune response of the virus. And compared to 30 years ago with HIV, that was not possible.
Yeah. Well, Dr. Badley, thank you for that. And we'll keep the support coming. But any kind of a timetable on when the therapeutics that you're developing, if they continue to show results? Because I know a vaccine is a year off. All the task force doctors have told me that from go, based on 3 different clinical trials. But therapeutics, we continue to hear, may be available this summer. Is that a possibility in any that you're working on?
I think we will see results from phase 2, which are early stage studies over the course of the summer, which will show promise. To show efficacy to lead to FDA approval are going to require much larger studies that will begin to accrue midsummer to late summer. And with the rate of enrollment, I think it's possible we could have approved drugs within single-digit number of months.
Within when?
Single-digit number of months.
Yeah. And Dr. Hahn, do you want to speak at all about the development of therapeutics?
Yes, as you probably know, there's 70+ clinical trials around the country, and we've issued a number of INDs for experimental and off-the-shelf drugs, just as Dr. Badley said, and we're, of course, very hopeful about the promise of those drugs. We're expecting in some of the trials a readout as early as late May, early June for some of the trials. And you're right, we have to wait for those data to help us make the determination of the gold standard of safety and efficacy. But we're very encouraged by the incredible response we've seen, academic centers, hospitals around the country. And so, our first step here is to look at the therapies directed against the virus, and then we can move to the antibody therapies and the vaccines as a sort of bridge before we get to the vaccine. So I agree with your timetable. I can assure you that FDA will be looking at the data as soon as they're available and making decisions, as you say, within hours and days, not weeks and months.
Right. They've been working around the clock. Yeah. Thank you, Dr. Badley.
Thank you. Hailey, why don't we get to you, and then we'll end with Dr. Maurice, and maybe you can tell us a little bit about your experience in the front line.
I work on a designated COVID positive unit at St. Mary's Hospital, so we only care for positive patients. So I have been feeling very safe and comfortable coming to work because we treat everyone the same in the PPE that we're wearing. We've been able to be more in touch with our patients without physically going into the room because we have tablets in each room that we can video in and be able to keep a closer eye on them, especially because the patients on our floor seem to be progressively sicker, and so we can keep a closer eye on them in that way. It's hard to educate the patients because we still don't know a lot about this disease progression. So we have been working on making them feel more comfortable since visitors are not allowed. So I feel like nurses are acting as that role. So, yeah.
Well, thank you. I know you've been doing this with your colleagues, and you've been giving patients remarkable care. The letters we get from patients, you are truly their family in the absence of their family. And I know that you and others have been putting up photographs in the rooms so that people know that they're still being listened to, heard, and are still human beings. So thank you.
And Haley, just would you tell everybody on your floor, every one of the nurses there, how grateful we are to each and every one of them?
Of course.
It was very clear to us early on that you had to take on both roles. And it's heartbreaking for me to think of families that, because of the nature of the coronavirus, can't visit a loved one when they're seriously ill. We understand at least we can appreciate the burden that places on you. Other than providing healthcare services, you're, in a very real sense, you're ministering to people, filling in for their family and their loved ones. And I just want you and every nurse in America to know that we understand that, and people across this country couldn't be more grateful, each and every one of you.
Thank you, Mr. Vice President.
Thank you. Keep up the great work.
Thank you. Mayo Clinic loves our nurses, and so thank you.
I can tell she's a great
Yeah.
nurse. You can tell.
Dr. Maurice.
Well, first of all, I'd like to thank you all for taking the time to visit us. It means a great deal to all of our staff that you're here.
Thank you.
Mr. Vice President, Commissioner Hahn, I want to thank you for your leadership. As you mentioned, I had the opportunity to visit your team at March 4th on the White House to be part of the national solution for testing. Since that time, we've provided over 120,000 tests, 30,000 of those for Minnesotans, and we really have tried to serve our communities to the greatest extent possible since the onset of this. I want to thank Governor Walz for his leadership, and as you point out in your documents, it's one thing to have the intent to share what we can do. It's another to have the actual structure to do that. And so under Governor Walz, Commissioner Malcolm's leadership with the University of Minnesota, really being able to serve our communities here in Minnesota has been astounding. So we're very grateful for that. And most importantly, or as importantly, has been our serving of the Mayo Clinic practice and our patients. You know, since the day one, we've been really focused on our patient needs. That helps us inform us in the best way to use the test to really manage the pandemic, not just for Rochester and not just for Minnesota or for Arizona and Florida, but really for all the Americans that are trying to confront this. And not only that, understanding not only where testing needs to be today, but where it needs to be tomorrow. So we're very engaged in the innovation, thinking about things like antigen testing, things that will make it possible to test the pre-symptomatic so that we can really understand, trace, and isolate effectively. And it's really a reflection, again, of our ability to learn what our practice needs is really what Minnesotans need and what Americans need. And so having, like many of us, spent my career here, Mayo is founded on teamwork, and it's just a great privilege for me and for all of us to take that teamwork and make it work, not just for Mayo Clinic and not just for Minnesota, but for the nation. So we're very grateful for your leadership.
Well, we're grateful for yours and for the innovation reflected here. How many tests you said you've processed from around the country?
So around the country, over 120,000 that we have done today.
No, just in general.
Oh, just in general. Oh, last year in 2019, we did 25 million tests here in Rochester.
Right, but just on the coronavirus.
On coronavirus, 150,000.
150,000.
120 for the nation, 30 for the state.
But the capacity to go forward is in the millions.
Yes, exactly. We continue to scale. We continue to use what we understand about logistics to bring that forward.
Right.
And we also continue to want to think about innovative ways so we can do testing as much out in the communities where it needs to be as possible.
Well, you've been a big part of the American solution on testing, and not just for Minnesota, but for the country as a whole. And we're truly grateful. Give your whole team our very best, will you?
I will. Thank you.
Truly grateful.
Thank you. This gets to the end of this roundtable. We want to make sure you know how much, one, we appreciate all of you being here, but also how deep it is inside our DNA to want to help. We'll help in any way. We'll rise to the occasion, and we can assure you we'll do it with the greatest of scientific integrity, with an eye always on the needs of the patient, and always doing it in a way that offers hope and healing at the same time. So thank you.
Well, Dr. Ferrugia, thank you for those eloquent and heartfelt words, and more importantly, for your strong leadership here. It is inspiring to have walked the hallways with your team, and inspiring to hear the incredible innovation and profound care reflected in everyone around the table. I know that Dr. Hahn and I will have a great deal to talk about on Air Force 2 on our way home, and I'm grateful for his full collaboration with all of you, and FDA's collaboration will continue that on therapeutics and every other measure going forward. Congressman, thank you also for the strong support that's represented in the CARES Act and all of the legislation, including what the President signed. We're providing support directly to American families, to small businesses, but we're also providing support to hospitals. And I appreciate you being a voice, not just for Mayo Clinic, but for healthcare providers around Minnesota, around the country. And Governor Tim Walz, thank you so much. Thank you for your leadership. Thank you for your partnership. We served together in the House of Representatives when we were both members of Congress. And I know the President is grateful, and I'm grateful for the way from the very beginning. You said we're one team, one mission, and I want to commend you for harnessing the strength of the Mayo Clinic, University of Minnesota, and really setting the pace, not just in the Midwest, but around the country, and scaling testing. And I want to assure you, as the President reflected yesterday, and as we did on several of our recent conference calls with you and other governors, that we're going to continue to fully partner with you as you lead Minnesotans to that place where we can reopen, we can put this state and all the good people of this great state back to work. And so I pledge that partnership to you. And the last thing I would just say to anyone that's looking on, particularly some of the 39,000 dedicated men and women here at Mayo Clinic, just thank you for what you do every day. You're healers. And far beyond the coronavirus, long before it arrived and long after we've dealt with it as a nation, the Mayo Clinic will continue to be synonymous with the highest standard of care in America. And on behalf of your President and on behalf of a grateful nation, I want to say to each and every one of the dedicated doctors and nurses and researchers and support team here, just thank you. Thank you for what you're doing every day, and to be a part of the healing of this nation. I leave here today with renewed confidence that with leadership of our President, strong partnership, state governments, and the strong partnership with incredible healthcare providers like here at Mayo Clinic and innovators, and with the cooperation of people of this country, that we'll get through this. We'll get through this together. We will protect the most vulnerable. We will put America back to work, and we'll heal our land. So thank you all very much, and God bless you. Keep up the great work.
President of the United States in Minnesota, just wrapping up a live roundtable with folks from Mayo Clinic, Governor Walz, of course, also with University of Minnesota, regarding the Mayo Clinic University of Minnesota combination, saying how they are uniquely capable of leading this COVID-19 task force, the efforts. They have the structure and the expertise here. Pence, as you heard there, Vice President thanking Walz directly for his leadership, the one team, one mission that was exhibited early on. The White House thanking Governor Walz for his leadership there, and also some statistical information talking about how far out we are with the vaccine and how much work Mayo and University of Minnesota has done, allowing health professionals to quickly get a handle on testing and tracking, and now moving into therapeutic work. So clearly recognizing the work that the Mayo Clinic and the University of Minnesota has done in leading this COVID-19 effort. We are now waiting for the daily briefing from the Minnesota Department of Health. They too are getting ready to address the media right now. So now from St. Paul about the state's response to the COVID-19, including new cases and investigation findings. Let's go to St. Paul live now.
One person in their 100s, one in their 90s, two in their 80s, 7 in their 70s, and 4 in their 60s. As of today, 1,912 patients have been released from isolation. 314 patients are currently in the hospital, 120 of those in intensive care. So we have seen over the last week or so a slight shift toward more hospitalization in the non-intensive care beds. I think with that, I'm going to turn it right to Chris for some additional comments on the increases that we're seeing in testing and what that means.
Thank you, Commissioner. Yes, I just wanted to make sure that we talked a little bit about case numbers. I know that we oftentimes, will get questions from reporters saying, well, you were seeing 100 cases a day and now it's jumped up to 150, or you were seeing 200, and what does this mean? And so I want to acknowledge that with the increase in testing, both with the governor's goal of increasing testing, and so, opening that up to some extent, as well as with the intensive testing that has been done at various agribusiness plants across the state, we are seeing a big increase in our case numbers. And so we want people to know that that is happening, that when you see additional cases, that's to be expected. With more testing, we will see more cases. And so I want to lay that out, that in the next number of days, we are going to continue to see more and more cases. And people should not be shocked or concerned, because as you recall, when we were talking about our cases earlier in the pandemic, when we had less testing capability, we talked about how each case represented just a portion of what was really happening in the community. Now that we have more testing, we are having a chance to actually measure what's happening in the community. So I want to put that in context so that people understand that there will be more cases. And then we did get a specific question yesterday about the fact that the deaths in Minnesota represented a higher proportion of cases than were being seen in other states. And I did comment that, part of the reason for that is because our testing has been so targeted. We have prioritized individuals in long-term care settings for testing, and as a result, we have been testing a higher proportion of very vulnerable at-risk individuals who are predisposed to more severe disease and, unfortunately, death. So the numbers that we were seeing were not a true representation of an assessment of the total population. And as an example of that, yesterday, our deaths represented 7.49% of our cases, and today, with increase in cases in other sectors of our population, that has dropped to 7.14%. So we will continue to likely see that change as we're doing more and more testing in what would be considered a less vulnerable population. So just wanted to bring those 2 points to your attention, and I will now turn it over to Assistant Commissioner Dan Huff.
Thank you, Chris. Good afternoon. Excuse me. Good afternoon, everyone. Wanted to provide an update on where we are in our testing strategy as we launch what Governor Walz describes as our moonshot to increase testing statewide to everyone that needs it. A week ago, we reported 927 tests done in a day. And since the governor made his announcement, we have exceeded 2,000 tests a day. And today we are reporting 2,412 tests being done yesterday. So more than doubled from a week ago. That's good news. We're not where we need to be on testing. We know that this is a ramp up. It is not something that you flip a light switch and it comes on, but rather we are increasing capacity every day. Some of the major accomplishments in this agreement one is that we now are developing an integrated testing system statewide with every healthcare system in the state. So instead of only being dependent upon your particular healthcare provider, we now have a statewide network so that if one provider is low on capacity, we're able to tap into others. And by contracting with Mayo and the University of Minnesota, we are opening up that excess or surge capacity. We do have a testing coordination center that is working with representatives from our various healthcare organizations and Mayo and the university and MDH to make sure that we are integrating and providing testing statewide that people need. We've launched a website where clinics can send us their information of where they are doing testing. That website changes every day as clinics come on board, or if they run out of supplies, they may go quiescent until they are able to get supplies again. So check that website for any updates as those occur daily. We're also now beginning to ramp up the other parts of our testing program. One is looking at contact tracing. As Chris Erzman discussed some of the work that they have been doing, she and her team are an amazing group of hardworking disease investigators. However, we are now moving into unprecedented levels of testing, and we will need to have unprecedented levels of case investigators. So we're beginning to ramp that up, training more people within the department, training people in local public health as we expand that network. We're also looking at how do we target our priority populations. We know in recent cases, and as Chris described, we have hotspots in long-term care, in our food production, and these are all priority populations that we are looking to test. We want to test people in congregate care settings, long-term care, prisons and jails, homeless shelters, etc. We want to test people experiencing homelessness. We want to focus priorities on communities of color because we know that they have been disproportionately impacted by this virus nationwide. We are looking at testing workers in our critical infrastructure, utility workers, transportation workers, our child care workers, people involved in food production or in working in the grocery store. All of these workers are critical to the daily functioning of our society, and we are prioritizing them for testing as well. As we develop this moonshot approach, we will have some, jumps and starts as we launch into this. We're making good progress. We're by no means where we want to be. We do not have the capacity to test everyone that we want to test today, but we have doubled that since a week ago, and we will continue to increase that. Thank you. With that, I'm going to turn it over to our medical director and state epidemiologist, Dr. Ruth Linfield. Dr. Linfield is going to talk about one segment of testing or one category of testing that we're hearing a lot about, and that is serology. Dr. Linfield?
Thank you very much, Assistant Commissioner. We have been getting a lot of questions about serology, and so I thought it would be useful to spend a little time to explain what serology is and limitations and potential uses. So what serology does is it measures antibody or an exposure to something. And in order for one to measure that, it takes a little bit of time to build up antibody. There are different types of antibody, IgM, IgG. It can take about a week to be able to measure the IgM levels. It can take 2 to 3 weeks to peak the IgG levels. And so depending when after exposure one does the test, one may or may not be able to detect antibodies. Another issue is whether the antibody is protective or not. And there are certain kinds of serological tests that are measuring antibodies, but they are not measuring what we call neutralizing antibody. In order to do that, you need to have cells that have virus growing on it, and you put the person's serum at different dilutions, and you see if the antibody that is present can prevent that virus from replicating or neutralize the virus. And that can help us understand, does someone have protective immunity? It's not an absolute correlation, but it is a good one. There are not many tests that have viral neutralization. Most of these tests are just measuring whether there is binding to a viral protein. We also don't know if someone who has antibodies, they're exposed to COVID, to the virus that causes COVID-19, if they will be protected from disease. People are actively doing research on this now, and we just don't have that information yet. We also don't know if there is protection, how long it lasts. Does it last for 6 months? Does it last for a year? Does it last for 2 years? We don't know. This is something that we are all learning. So how do we use antibody tests against SARS-CoV-2, the virus that causes COVID? Well, right now, a good use would be to understand on a population level how many people may have been exposed to this virus. And that can help us understand the scale of the current pandemic in Minnesota communities. Another use is there's a research study going on right now on utilizing people who have had laboratory-confirmed SARS-CoV-2 infection because they were PCR positive, and it is looking at whether using their convalescent plasma to help other patients who have COVID-19. And for that purpose, it's helpful to figure out who has antibodies. We do not know at this point in time how to use antibodies for individual decision-making. And that is because of a number of things. Number one, there are now more than 100 serological tests out there. They have a variety of performances, and some are not as accurate as others. And in fact, there is a national group that is evaluating the various tests that are out there. But even if you have a test that has very good sensitivity, so it can detect the antibody, and very good specificity, which means it's detecting SARS-CoV-2 and not one of the other human coronaviruses, or not cross-reacting with something else, the accuracy is going to vary with how many people have been exposed, because these tests are not 100% sensitive or 100% specific. And when there are fewer people in the population who have been exposed, the chances are that the positive is a true positive, or what we call the positive predictive value, falls. And we will have a certain number of people who test positive who aren't truly positive. And finally, the other thing is, again, we don't know what it means. We don't know if somebody has antibody present. We cannot say that you are not going to get infected again, because we don't know that. We don't know if you get infected again. You may still be able to shed virus and transmit to other people. So at this point in time, really the uses for serological testing are for seroprevalence, and we are going to be doing some of these studies in Minnesota to determine how widespread the infection has been, and for use for identifying persons that have an antibody response that can serve as convalescent plasma donors. Thank you.
Thank you, Dr. Linfield. As we start the question and answer session, we'll ask that reporters limit questions to one primary question and one follow-up, and that you limit multiple questions from each media outlet so we can.
Well, you've been watching today's COVID-19 briefing from the Minnesota Department of Health, and just before that, we brought you live to Vice President Mike Pence in his roundtable with the Mayo Clinic and University of Minnesota researchers. And just prior to that, we also heard from Wisconsin Governor Tony Evers' daily update on the Badger State's COVID-19 efforts. We will continue to track all of these developments this afternoon and, of course, bring you updates as they happen on the WDIO website, our mobile app, and, of course, tonight on WDIO News starting at 5 o'clock. Have a good afternoon.
This has been a WDIO News special report.